Hello again. My name is Dr. Don Pereslete, and welcome to another episode of Just Ask Your Dentist. Today's question: what's the difference between a manual and an electric toothbrush? Okay, let's start with manual toothbrush. Been around for hundreds of years, works really well. So the main difference between an electric and a manual toothbrush is really based on patient preference and effectiveness. So whatever you use will work as long as you use it effectively. So manual toothbrush, I'll give you a quick demonstration on how to use it effectively. If you hold the toothbrush bristles at a 90-degree angle into the gum line and work it using a small circular stroke from the back of the teeth moving forward, develop a pattern for yourself or a system. So beginning on the back teeth, moving forward to the center, and then starting on the other side, moving forward to the center. That develops a pattern that can be repeated on each arch. Give yourself 30 seconds per side when you open. Again, start on the back teeth, 30 seconds to the front, and again on the inside up to the front. Repeat the same thing on the bottom, starting with the back teeth, moving to the center. That way you'll be sure to hit every space, every little groove, every little crevice. One particular point I'd like to bring out is when you're cleaning your front teeth on the top and the bottom, try to hold the toothbrush vertically, using the toe end of the toothbrush vertically up under the back side of the teeth, like this. Again, using a small circular stroke, spend about 15 or 20 seconds behind the front teeth like that, and then dropping down on your lower front teeth. Again, working the toe end of the toothbrush into the back side of the teeth in a vertical manner. Try to avoid coming across the side of your mouth, holding the toothbrush like this. You'll notice if you try to brush the back side of those teeth doing that, you'll see that the curvature of the arch doesn't allow those bristles to get in and contact those teeth very easily. That's why we suggest using the toe end of the toothbrush in a vertical position. So, manual toothbrushes work great. Remember, when you're about 3 months into it, it's probably not effective anymore. Throw it out. Get a new one. Let's talk about electric toothbrushes. I happen to have the Philips Sonicare Elite. It's a great toothbrush. I don't own stock in Sonicare, but Oral-B also makes another fine electric toothbrush. There are numerous other electric toothbrushes for sale in the drugstores that you can spend probably $5 or $10 and put a little AA battery in the back. It works great. Kids love them. Fantastic. The nice thing about electric toothbrushes is that it takes away a lot of the work you have to do. You turn it on. It has a timer in it. It'll tell you when to switch sides. It'll tell you when you're done. It goes for about a maximum of 2 minutes. You can always push the button again, go for 4. But again, when you're done using the toothbrush after 3 months, the heads are replaceable. Throw it away, get a new one. That's what keeps it effective. So, to review, again, manual toothbrush versus electric, patient preference. Just make sure when you use them, you're using them effectively. Brushing every little crevice, every little space in between teeth, every little nook and cranny on top, and spend some time doing it. That's the biggest factor in the effectiveness battle. Patients tell me, "Oh, doc, I brush for 3 times a day and I spend 5 minutes in front of the mirror every morning." If you actually put a stopwatch in front of them and timed them, it's probably like 15 or 20 seconds. So, not a bad idea. Get a little egg timer, put it next to you, turn it over, it goes for 2 minutes. Spend 2 minutes. That's the minimum. You can go longer. Flip it over twice. Hey, go big time, go for 4. In any case, effectiveness. That's the key point. The condition of your toothbrush is important. Bristles start to flare, or some toothbrushes have a little color code indicator that changes color when it starts to get used. Follow that and throw it away. After 2 or 3 months, it's no good anymore. The bristles get splayed out, they're not effective. Throw it out. Get a new one. Go to your dentist. most dentists give them away every time you get your teeth cleaned. Not electric toothbrushes, but we give away manual toothbrushes. You can go to Costco, you can go to any one of those department stores, or Bed Bath & Beyond, or CVS. They all have electric toothbrushes in their aisles. So invest a little bit, buy an electric toothbrush if you don't feel like you have the dexterity to use a manual toothbrush. I emphasize, again, effectiveness is the key to it all. So thank you again for watching. See you again on another episode of Just Ask Your Dentist.